first thing that we're going to address with the knee is patellar tendonitis. So we're going to start looking right below the patella of the knee, and that tendon runs down to a spot right on the lower leg that's usually quite prominent. So we're going to start by scanning just to see how rough that is. And we're also looking for how far over the roughness extends along the front of the knee. This is going to be very prominent in weightlifters, long distance runners, jumpers, things like that. So once we determine that, we're going to be treating from about here to here. A little bit of lotion. The lotion has no healing effect. It's just there to keep the skin from being too drugged on. So we're going to push, and again, we're going to do the 10 strokes up. For this area, the crook of the shark fin works really well because it treats the whole area in one stroke. And I'm just moving back and forth across. And we're going to flip and drag down. This is going to be the same treatment of the lower leg for the specific condition called jumper's knee. The other area that gets treated with jumper knees is going to be the lower quadriceps, which is all the muscles above this part of the knee. So what we're going to do again is scan the area to see exactly where the most damage has accumulated and where the knee pain is actually coming from. If it's not found, if there's no scar tissue found, then you'll leave that area alone because that's not the cause of the pain. In this particular case, we're finding a lot of the roughness on the inside of the knee. So what we're going to do is we're going to start and treat there. I'm going to use the wide surface in this particular case. Ten strokes up. And when I'm going to go 10 strokes down, I'm just going to take a little tension out of this muscle by pushing the foot back a little bit. That's going to make all that scar tissue and damaged tissue become more prominent. And then I'm going to stroke down. Ten strokes down. And then we quit. The last condition that we're going to work on in the knee is just generalized sprain strains, where we may not have done something in particular, but we're just having knee pain. The most important part of treating a generalized knee strain is simply scanning the whole area to determine which muscles are actually causing the pain. Most time, it's not point tender, meaning you can't feel exactly where the pain is coming from. So what we're going to do is just do a general scan and see if we can pinpoint that, and then that's where the treatment's going to occur. So we're going to start with just a small tip of this because that's more specific. So we'll run the outside and just keep moving. We'll scan all the way over. We're going to start on the back. Even scan down in through here a bit. Bottom of the knee and right around to the front. Everywhere that you feel the gravel or that is tender or point tender is going to be an area that needs to be treated. So you'll follow the standard protocol: small amount of lotion and then 10 strokes on each and every spot that the feeling of scar tissue is. Again, being careful enough to not have a lot of redness or bruising just a very light stroke, enough to feel the scar tissue, but we're really not pushing very hard. The amount of tension applied by the instrument doesn't have to be very much to have the treatment be very effective. And remember, doing this once or twice a day is going to clear this up rather quickly.